at the moment, all data speak in favor of using CAR T-cell therapy first and then switch to bispecific antibodies, because we have data that pretreatment with bispecifics is interfering with the efficacy of CAR T-cells. In contrast, CAR T-cell treatment only has a limited effect on the efficacy of bispecific antibodies. So I think at the moment, it's CAR T-cell first, then bispecifics. And the question is whether we have to change the target of the bispecific after the CAR T-cell. And this is, I think, a question that is not resolved at the moment. Bispecific antibodies are clearly an off-the-shelf treatment. So several studies are using bispecific in first-line, second-line, third-line therapy. And as with CAR T-cells, we see bispecifics moving to earlier lines of therapy as a kind of consolidation or a limited maintenance therapy for patients following stem cell transplantation.